Hi guys, I thought I'd do two episodes back to back, but they're under a different project, obviously. Welcome to episode 125 in Cybercrime. What doctors and clinicians must legally do to protect EMRs, electronic medical records. Give me 1 second. Yummy ice. All right. What doctors and clinics must legally do to protect EMRs? Once across Canada, health providers are legally responsible for EMR privacy and security, who are called custodians. And I introduced those in the previous episodes regarding EMR. In Ontario, it's under the rule called PHIPA, PHIPA. The security safeguards are mandatory. Providers must use reasonable safeguards. However, that doesn't always protect everybody, or obviously people that started ransomware. It took them half a year actually at least to find a penetration point in the a healthcare insurance company system that's connected to a Medicare down the states, and that is how ransomware started. But it took 6 months for them. There is always going to be people that's better than you. There are hackers better than you. There are black hackers better than white hackers. There are white hackers blacker than, gray hackers better than black hackers. It doesn't matter. It goes around, and we can only do our best to protect it. At least in my circumstance, I don't protect it as much as I could, and I got harmed. Administrative, privacy policies and staff training, confidentiality agreements, role-based access. Only those who need access get access. So access control is extremely important, especially in EMR. There should literally, doesn't matter how big the company is, there should be one privacy officer that has access to absolutely everything. Maximum 2, because there is no chance that that person will not be responsible to look up the records of the actual log, or you say raw data, or metadata, doesn't matter, that he's the only one that has access to it. So that gives him the responsibility to take on, instead of having corruption with people trying to access it or not, and so forth. I talked about it before. So technical, unique user IDs, strong password, audit logs, encryption, automatic logouts, and session timeouts. Using 20 years ago, we were using RSA already, and everybody's got a little device, and every minute we have to change the password if you log in again, kind of thing. So it's kind of like now the authenticator is 60 seconds. That's what it is, right? It's RSA technology. Physical, locked offices, server rooms, screen privacy, or offsite document storage is important as well. And also a legal term to prevent force majeure as well. For damages such as flood and hurricane and all that stuff. It should be the physical copy that needs to be retained after a certain period of time. I believe it is 10 years in Canada, and electronic record is at least 6 years. I can be wrong, but they're constantly changing and constantly amending it, updating it, and we are still not there yet. So, all right, audit logs and monitoring. Okay, breach detection notification. If there is an unauthorized access, there's hacking, there's lost theft of a device, there's employee snooping, even any bit of it, the clinic or the physician must notify the patient as soon as feasible, notify the provincial privacy commissioner, as well as document the breach and mitigation steps. Failure to report itself is a legal violation as well. So clinicians obviously should be putting prevention support. In my case, I did my best, and it still got stolen, and they're still after my data, and now they have my company data, and I have to start all over again, and my company data is stolen once again. So look up JennaChou.com, and that is my company. They deregistered it. It was supposed to be until 2026 August, but somehow I was able to find my company, Healthcare Heart. Anyways, take care, guys, and I hope you enjoyed this episode.